Sharon for the
Good evening. We're just opening up the evening's webinar. Come join us. We'll get ready to start just after 7. We're just waiting a moment for a few more to come in before we get started. We'll start just after 7 this evening. Thanks. Okay, I'm going to start introducing this evening's webinar. Good evening, my name is Sharon Foster and I'm a professional practice associate at WeRPN and the education coordinator as well. Tonight you're joining us for our quarterly research webinar. It is our duty to care through COVID-19, experiences of personal and professional resilience of registered practical nurses in long-term care homes with Dr. Denise Connelly. I invite you to make sure that your microphones are turned off, and if you could hold on to your questions till the end of the evening's presentation so we don't interrupt our speakers, and you'll have an opportunity then to ask any questions. So I will now hand over the evening to Annette Weirs to start.
Thank you, Sharon. Good evening, everyone. My name is Annette Weirs, and I'm the Senior Director of Professional Practice and Research at WeRPN. I'm just going to provide you with a little background about this work, and then I'm going to introduce our speakers for the evening. Collegial support, confidence, and resilience are rooted in the experiences of RPNs. This was never more important for registered practical nurses working in long-term care homes than during the COVID-19 crisis. This research study asked RPNs to tell their story. Understanding these experiences from COVID is critical to inform the development of health, social, and institutional policies within the long-term care home sector. Dr. Denise Connelly, Western University, will present the results aimed at understanding the experiences of RPNs during the COVID-19 pandemic through the lens of personal and professional resilience. Then Norma Tomlin and Calver will share how the research findings have informed the development of supports, programs, and resources by WeRPN to help nurses and long-term care employers become and remain resilient in their duty to care in long-term care homes and across practice settings during this pandemic and beyond. So let's begin by introducing the speakers. First, I'd like to introduce Dr. Denise Connelly. She is Associate Professor, School of Physical Therapy, and serves as Associate Vice Provost, Academic Planning, Policy, and Faculty. Her previous university administrative roles included Chair, Master of Physical Therapy Program, Assistant Dean, Interprofessional Education, and Associate Dean, Graduate and Postdoctoral Studies in the Faculty of Health. She has worked professionally as a physiotherapist on inpatient orthopedic hospital units, and in long-term care homes as a member of the interprofessional team. Dr. Connelly contributes to health professional accreditation as a peer reviewer, Physiotherapy Education Accreditation Canada, and associate editor, Physiotherapy Canada. In the community, she serves on the Trios College Program Advisory Committee for the Physiotherapy Assistant and Occupational Therapy Assistant programs. By investigating experiences of older adults themselves, exercise training studies for improved function, and the development of outcome measures for low mobility, Dr. Connelly's academic research program focuses on rehabilitation to promote independent living in older adults. Further, her research supports the RPN workforce, providing care for older adults living in long-term care homes to promote high quality of life. Themes explored in this research include resilience, enhanced family and care partner involvement in care planning, and leadership of RPNs within the long-term care team. Currently, she's leading funded research projects addressing resilience on the job as a home care nurse, which is funded by a SSHRC partnership engagement grant with our partner RPN. The novel virtual team-based care plan pieces framework with RPNs in long-term care, funded by Healthcare Excellence Canada and administered through the Canadian Institute of Healthcare Research, implementation science teams, strengthening pandemic preparedness of long-term care, building capacity in rehabilitation through nursing practice of RPNs working in geriatric and stroke inpatient rehabilitation units funded by WeResearch. And this includes the provision of RPN Research Fellow funded by the WeResearch Fellowship Program. Next one is return to physical activity following discharge, 1 year post total knee arthroscopy or arthroplasty funded by a mid-career research grant from the Faculty of Health Sciences, and building capacity in clinical education with virtual placements for physical therapy students funded by the internal Faculty of Health Sciences research grant. Presently, Dr. Connelly supervises 3 postdoctoral associates, 2 doctoral and 2 master's graduate students, 4 professional master's nursing students, 3 undergraduate students in research activities. You are a very busy lady. Our second speaker is Norma Tomlin. Norma is the professional practice manager of WeResearch, and for 3 decades, she has held various leadership roles across the healthcare sector. She has dedicated the majority of her career to support domestic and international nurses' professional development, teaching them how to optimize their practice to support the healthcare system and the patients they serve. Norma recently completed the Bachelor of Health Administration program at Toronto Metropolitan University, formerly Ryerson University, and has been accepted to begin her Master's of Health Administration in Community Care this fall. She is also a certified resilience practitioner, having completed an intensive resilience at work training program to support individuals use a practical application to develop and build personal resilience plan. And she's currently continuing that resilience at work for teams. Jen Calver will be following Norma, and Jen is an RPN in Southern Ontario. Jen's first introduction to working with older Ontarians began when she became a hospital volunteer at the age of 13. That shows her dedication. Her lengthy career working in both regulated and non-regulated job roles in healthcare inspired her special interest in nursing, aging, and health service research. She was among the first group of RPNs to receive her CNA certification in gerontology nursing for RPNs. Recently, Jen completed her Master of Health Science degree at Ontario Tech University in Community, Public, and Population Health, with her thesis focusing on nurses' perspectives on policy to end hallway healthcare. More recently, Jen has engaged in developing her skills and competencies as an RPN researcher. Jen has worked on research projects exploring workplace bullying, incident of injury for children and adolescents with disabilities, family planning, women's careers in academia, impact of COVID-19 and healthcare practitioners, and RPN resilience. Jen says she's grateful for the opportunities to collaborate with Dr. Connelly and her research team, including WeRPN, to explore how RPNs adapt in times of personal, professional, and institutional crisis, and is looking forward to sharing with you the organization Resilience and Long-Term Care Guide. So, oh, and I have one more person to introduce to you. It's Dr. Nancy Snowblin. Nancy is a research consultant for WeRPN. She has developed and is implementing WeRPN's research strategic plan to create a more robust body of evidence about the role of RPNs. She has been working alongside all the presenters this evening to enhance the personal, professional, and organizational resilience of those in the healthcare system. Nancy has several decades of experience working with RPNs. She formerly held administrative and clinical roles in specialty and community hospitals. She is a registered speech language pathologist, currently non-practicing. She holds a Doctor of Health Administration, a Master's of Business Administration, and a Bachelor of Science in Communication Disorders. Her passions are ensuring healthy, knowledgeable, and respected staff experts to create high quality care and the best outcomes for all Ontarians. So thank you for joining us today. And I'm going to turn this over to Dr. Connelly to start our presentation.
Thank you very much, Annette. I'm really pleased to be here tonight. And thank you for joining us this evening. I'm hopeful that that's showing okay for everyone there. Our study over 2020 talked to registered practical nurses who were working in long-term care during COVID with the aim to explore their experiences of resilience. And our research team represents academics at Western Royal Roads University in BC, the University of Toronto, registered practical nurses and members of WeRPN, and practical nurse educators, and Dr. Snowblin as a representative from WeRPN, and Dr. Sinha from Toronto. I'm sure you're all very familiar with him. And we had postdoctoral fellows, and we had a few undergrad students joining us as well. It's been a real pleasure to work with Diane Martin, Annette Weirs, Tiff Blair from WeRPN during all of the research, and Dr. Snowblin I recognized as a member of the research team. Further, Samantha Salentino was part of the research team when she was with WeRPN, and she often helped us with a number of administrative tasks, scheduling, archiving materials, sharing her RPN experience, and helped us develop the surveys and the interview questions that we used in the study. Sandra Osborne jointly shared her story as an RPN working in long-term care during COVID, during an event hosted jointly by the research team and WeRPN, bringing stakeholders together from a number of organizations and sectors to talk about organizational resilience as it related to the experiences of RPNs themselves, long-term care homes, family and care partners, and spouses of residents during the COVID pandemic. It was a forum. Funding was for the study was from SSHRC. We had a partnership engagement grant. RPN was our partner. We were also successful with MyTax Accelerate, and Anna Garnett, one of our researchers from the School of Nursing at Western University, achieved a Western Knowledge Mobilization Fund that contributed to publication of our findings. This is a roadmap, a summary of the research activity that we accomplished over that one-year project. And phase one was largely about organizing the project design, our strategies, our recruitment, our literature review, assimilating knowledge of the political, regulatory, and professional COVID-19 situation to inform our survey questionnaires and our interview guide. We welcomed many students to our project, including a doctoral student, Cecilia Flores Sandoval, and a postdoctoral associate, Claire Wilson. Phase 2 focused on recruitment and data collection. We heard from the voices of RPNs themselves about their experience working in long-term care during COVID-19. Phase 3 was conducting our analysis of the collected data, and our findings were disseminated in Phase 4. A little bit of background about long-term care to orient you to that sector. It's the most regulated sector in the health system under the Long-Term Care Act and Ontario regulations. RPNs are the largest regulated workforce in long-term care. The mandated health services for residents living in long-term care include 24/7 nursing care and supervision, primary medical care, and help with basic activities of daily living and interests in a safe and caring home environment. More than half of residents in long-term care are older than 85 years. 90% are living with cognitive impairment, physical frailty, and multiple chronic health conditions. 86% of residents require extensive help with basic activities of daily living, for example, getting out of bed, eating, and toileting. In Ontario, 626 homes are licensed and approved to operate. The breakdown of private, nonprofit, and municipal-owned homes, the percentages are there, with the majority being private. A little bit of rationale about our study. The long-term care system has been historically neglected in an underfunded sector with the Romano report from 2000. Long-term care became a topic of great interest by newspapers and the television news during COVID, and not in a good light on many occasions. WeResearch identified the registered practical nurses as a vulnerable sector of frontline workers experiencing difficult working conditions. We found that they were largely underrepresented in terms of the resources that were distributed, with hospitals seeming primary in the eyes of the public. Resilience, we know, is key for health professionals to allow them to successfully and continuously navigate complex and stressful work environments. We think it's not necessarily exclusively, though, an individual trait, and is largely impacted by the quality of their social and physical ecology. So the purpose of our study was to contribute new knowledge about resilience of RPNs as frontline workers in their care of older adults living in long-term care. And registered practical nurses are largely unrepresented in the current research. The resilience model that we use is from Michael Unger. The definition of the model of resilience is here. He describes it as a sequence of systemic, interdependent interactions through which the actors, whether those are the persons, the organisms, or the ecosystems, secure the resources required for sustainability in a stressed environment. Our central tenets were that personal resilience is a process by which people bounce back from adversity, from frustration or misfortune, using the psychological and biological strengths that we employ to cope with challenges and threats. Personal resilience addresses the individual capacity to thrive in a demanding workspace. And organizational resilience is whereby institutions recover after a significant disruption, referred to as institutional resilience, which affects workplace staff experiences. Our primary research questions: how do RPNs working in long-term care homes build and sustain personal and professional resiliency, including agency and capacity during COVID? And how are personal and professional resiliency of RPNs impacted by the long-term care home workplace during the COVID crisis? We developed an online survey and distributed it to approximately 5,000 registered WeResearch members working in Ontario long-term care homes. It was posted for 5 months between April and August 2021. It included questions to share, inviting RPNs to share their insights and experiences about working in long-term care, and included the Connor-Davidson Resiliency Survey, which is a personal resiliency measure, a resilience at work scale, and the resilience at work team scale, to capture the different effects of personal, professional, and workplace resilience. Our second methods to collect data were interviews. At the end of the surveys, RPNs were invited to let us know if they'd like to participate in a one-on-one interview by Zoom at their convenience. Examples of questions included, how do you recover after a personally challenging event? How did COVID influence your ability to bounce back? Tell me about your biggest challenge in your current role during COVID, was one of the questions to elicit experiences of professional resilience. How does your professional training as a nurse equip you to manage patient care in long-term care? Another professional resilience question was, do you feel that your colleagues in long-term care supported you during the COVID pandemic? And if so, how? Organizational resilience was tapped into by asking RPNs to describe whether or not they had the supports necessary in their workplace to be the best nurse they could be. And finally, for example, what lessons learned or words of wisdom would you want to share with others working in long-term care? The survey data included 434 responses from RPNs. Only 51 surveys were incomplete and we had to remove them. There was an 88% response completion rate, which was really remarkable given the conditions under which the RPNs were requested to complete the survey, which took approximately 50 minutes. The interviews were completed with 40 RPNs and lasted an average of about 41 minutes. In terms of the group of people who responded to our survey, the majority were women working in Ontario long-term care homes. The most frequent age range was 25 to 34 years of age at 30% of our respondents, and a little over, almost 54% were working full-time in Ontario long-term care with 4 to 7 years of experience as an RPN. Resilience on the Connor-Davidson personal resilience scale was considered low compared to values we collected from the literature. 54, a little over 54%, reported extreme levels of job stress, and almost 38% extreme levels of personal stress. Here is a bit of a example of the group data for the RPN survey respondents. The Likert scale is the way we measured it, with the anchors being 0 to 7. The anchor descriptors change depending on the questions, but for the resilience at work, they scored about 4.7, and the subscales of the resilience at work are there. I'll unpack this a little bit more as we go through some of the other findings to make sense of this for you. One way to represent the data is to show you, in terms of the subscales from the resilience at work survey or questionnaire, those subscales where the RPNs scored high compared to other values from the literature were living authentically and being connected. Living authentically means things like being able to maintain their personal values, use their personal strengths, and have good emotional awareness and regulation at work. Being connected. This subscale refers to being cooperative and supportive with each other and to encourage a sense of belonging among their colleagues at work. The subscales where they scored lower are more. So there's 5 of them out of 7. Their scores were considered low. So managing stress, maintaining perspective, building networks, self-care, and alignment were all low across our participants. Visually represented on our survey responses, we showed job stress on the left and personal stress on the right. The things that I want to bring to your attention are the moderate stress and extreme stress. Those are the lightest and the second lightest gray shaded areas, and they comprise the majority. So most of our participants reported moderate and extreme stress for job and personal during the time of COVID. In this diagram, the top 2 circles represent physical health, the bottom 2 circles, mental health. In comparing the top 2 circles of physical health before and during COVID, you'll see that the majority of responses are changed in the fair and excellent categories. So physical health during COVID was lesser. Excellent health reduced during COVID, I think is probably the easiest way. And poor health expanded. Mental health, poor health in mental health expanded during COVID, and excellent health decreased quite dramatically. So both physical and mental health were severely compromised, as you can imagine. Our interview findings, we had 38 women participate in our surveys and 2 men. 15 of them worked in private long-term care homes and 25 of them worked in public. For COVID, almost 78% of them were working in homes where COVID was on outbreak, and only 22% reported that there was no COVID outbreak at their long-term care home. When we put all the data together from what the RPNs told us about working, we saw that there were some themes that emerged, and 4 of them are captured here. Dynamic role of the nurse, preserving self, sense of leadership support, and banding together. Some quotes to demonstrate what was captured by these titles to these themes. That in the dynamic role of the nurse, one nurse told us, "I just keep going. I mean, resilience is the ability to bounce back from any situation, and I've always been able to. I don't know if I'm strong-willed or stubborn or what, but you just keep going." In preserving self, an RPN told us, "I have to detach, like as soon as I come home, I have to leave work at work, and I want to come home to a completely different environment, like a mini escape." In terms of banding together, one of our participants told us that a lot of coworkers' friendships have actually been affected by the impact of the pandemic and long-term care, just because everybody's so stressed and everybody's over it. The final one is the sense of leadership support. One of our participants told us right from the beginning, leadership were fully transparent with information. They worked tirelessly. They made sure we had everything we needed. None of them had holidays last year. They were there all the time. The executive director came in at night. I was totally impressed with how they handled the situation. A summary of the lessons learned are over the next couple of slides. And what we noted is that RPNs were able to maintain their ability to live authentically, which was captured by that questionnaire, where they were able to maintain their personal values, use their personal strengths, and had good emotional awareness and regulation at work. They had a lower capacity, though, to manage stress. Stress was coming from home, personal, and job. So their scores were lower on maintaining work-life balance and routines. They also had difficulty managing negativity and reframing difficulties and setbacks and focus on solutions at work. Their capacity was also challenged in building networks, their ability to develop and maintain support networks with their colleagues. RPNs noted a decline in both physical and mental health with extreme levels of job and personal stress. Resilience can help rejuvenate and retain, though, the workforce. And so it's important for us to determine what the strategies, resources, and workplace supports are needed. Leadership was critical, and a sense of leadership support was really important for the RPNs to maintain their individual resilience. Being visible as leaders, and then fueled by them, leaders going above and beyond the regular call of duty, was a real positive. Failing to achieve a healthy work-life balance, though, was a common comment, where they felt consumed by their work and struggled in trying to maintain some distance between their work and their own lives. The systemic staffing shortages and the burnout during long-term care calls for changes to the systems and the policies and practices. So we have summarized a few implications, and in the last few minutes that I have, I'll unpack this slide. Implications from our study focused on 4 different areas: the professional association, the professional college, the educational curriculum, and the employer and other stakeholders. For the professional association, advancing resilient supports for the RPNs and for the long-term care home managers and staff was really important. And trying to figure out how to build resilience in the RPN workforce is really important because of the long-standing staffing issues, the burnout, and the challenging work conditions. Providing the resources for the RPNs on a professional level includes a new self-learning resource focused on personal resilience, which has been developed by the WeResearch, and you'll hear a bit more about that. Its focus is to encourage individual or personal resilience and to attend to personal energy, physical health, self-care, adaptability, purpose, and networks and authenticity. For the professional college, there is work going on that will address resilience of the nurses and to include resilience as a construct in the curriculum for entry to practice. Creating guidelines is also very important for the safe and ethical practice of nursing care. Educational curriculum. Trying to incorporate resilience somehow into the educational curriculum to prepare the nurses for the setting that they're going to be working in, with staff shortages, perhaps changes in policies. The difficulty with the change at the time was that the health and safety regulations changed so frequently that often the staff weren't sure what the policies and processes should be. perhaps embedding in the curriculum self-advocacy and leadership skills to build their self-confidence, to be able to have crucial conversations with management and with their colleagues, and creating and recognizing their bedside expertise that they possess and that they implement during crisis planning. Their self-care. So working with the PN students about how to evaluate and creating an awareness of their own individual physical and mental and emotional well-being, and some experiential learning with resilience resources, such as apps or professional association resources, apprenticeships, so that they know maybe what works for them to build their physical and emotional health. Focusing also on some environmental factors for role dynamics, labeling their influences for and readiness for frequent change in resident health and behavioral expressions, which they needed to manage. Staying productive despite the increasing demands to deliver more with less. Managing the family and resident expectations because it may exceed their delivery capacities, and then maintain physical and emotional well-being despite the job pressures that they're experiencing. For the employer and other stakeholders, some resources around self-care and staffing and work-life balance, organizational supports to build team-based care so that there's collegial support in problem solving and an opportunity to connect with colleagues and to network with others to problem solve. Adapting the educational resources into mandated orientation and annual education and training sessions were some of the suggestions. Finally, one of the aspects of our research project was knowledge dissemination, and we created peer-reviewed manuscripts that are currently under review to be published in journals. Some articles and some newsletters were written, such as the WeResearch Spring Journal. We had a short one in there. Pulse, WeResearch monthly newsletter. We did a forum with stakeholders, and we did poster presentations at some conferences, the Canadian Association on Gerontology, and we contributed a consultation workbook from the forum to the National Long-Term Care Services Standard and submitted that in November. We did an invited podcast to the Seniors Junction podcast, which spoke about the isolation that experienced by seniors in long-term care. We contributed a bit to a WeResearch educational package for organizational resilience, and then did a presentation at the 2022 Ontario Long-Term Care Association and Ontario Retirement Communities Association. I think that is all the time that I have. I might have been over by a minute. Here's just what the publications will look like. And next steps, we're working on a grant looking at resilience in home and community care, and we have submitted a couple other grants. Thanks very much.
Thank you so much, Dr. Connelly. It's to you and your team for conducting this study. Throughout the pandemic, we heard from RPNs calling us and telling us about their experiences. And it's nice to see the evidence that supports what we heard and that we have recommendations to make a difference. So with that, I'm going to ask Norma Tomlin to talk about some of the activities that have been undertaken.
Certainly. Thanks, Annette. And Dr. Connelly, thank you for your extraordinary work looking at RPNs at the point of care and the effects of COVID and what they've been through, and looking at recommendations to build resilience, which is exactly, given us evidence as to the work that we need to do at the professional association to continue supporting RPNs at the point of care. So what I want to, and I'll just, Jen, if you can move the slides, that would be great. I want to cover and introduce some of the work that we've already undertaken at the Association Professional Practice to start building those resources to help guide individual resilience plans for our members and for non-members as well. So I don't know if you're able to move the slides. Maybe there's a bit of a lag.
Yeah, can everybody see the slides okay? Just wanted
Yeah.
to make
Yep.
perfect.
So just a little, I'll just go through the background a little bit about even further pre-COVID as well, and talk a little bit about what we understood about resilience at that point in time and self-care. And I'll speak of some of the research as well. I'll speak to the program design and the education design that we established currently with our resources and our self-learning modules. And then hopefully the program impact that this will have. And I'll provide some examples of the resources that we have established within the modules that have been developed. So just going back, self-care resources have been a priority for RPNs for the association since 2016. We were hearing anecdotally from our members and from RPNs across all sectors that self-care was an area where they were struggling to maintain, and they were looking for resources to help support their own well-being. So during a focus group, provincial focus group tour in 2017, it was confirmed that self-care supports were a priority for RPNs in Ontario. Resources were developed at that time, post or pre-COVID, around a self-care toolkit to help support RPNs with their physical, mental, and emotional well-being. As we know, this is all pre-COVID, so we can only imagine if there was identified pre-COVID, and Dr. Connelly's work has demonstrated the effects have significantly impacted profoundly the mental health and well-being of Ontario RPNs and the nursing workforce. According to one of the studies and surveys undertaken with WeResearch, 83% of RPNs reported mental health has been adverse. Their mental health had been adversely affected by their work, and even more alarming, that 67% felt that they didn't have adequate mental health supports just through COVID. So to respond to the urgent need, WeResearch proposed to develop new mental health supports that focused on anxiety and resilience through COVID. And that was added to our self-care toolkit at that time. In alignment with the recommendations from Western University on the impact that has been demonstrated with the RPN's resilience, RPNs developed the resilience resources to support RPNs, and ultimately resulting in what we hope is better outcomes for RPNs and the clients that they serve. So next slide. So some of the other ideas of what resilience is and what resilience isn't, with respect to just going through the ability to be able to adapt positively, the ability to either maintain or regain one's mental health despite taking part in adversity, and an inner strength. Resilience is not the ability to find stressful situations easy to deal with, and the ability to not feel angry or sad during a difficult time. Next slide. Next slide. So just some of the obvious benefits of building resilience is adapting to frequent changes and uncertainty, staying productive despite the increased demands to deliver more with less, and managing customer, or in this case, patient expectations that may exceed delivery and capacity, maintaining physical and emotional well-being despite job pressures. So having a resilience plan can help preserve one's well-being during adversity. Resilience is important, and it's demonstrated through the research that Dr. Connelly has presented here tonight to be important to give people the strengths needed to process and overcome hardships. Those lacking in resilience get easily overwhelmed, may turn to unhealthy coping mechanisms. And a resilience plan can provide healthcare workers with the tools and strategic resources to reduce anxieties and depression. When incorporating a resilience plan in one's life, it can be a positive, effective way to fostering emotional regulation capacity that supports meaningful and social connections. Healthcare workers have been exposed to stressors throughout the last 2.5 years. And we know that the effects will be seen for years to come. Through the global pandemic, the impact has been profound effect on healthcare workers, in particular nurses, and having a resilience plan supports the sustainability in their careers where they've been exposed, and to help support their mental and physical well-being. So Dr. Connelly talked about some of the work that the College of Nurses is doing currently. College of Nurses has identified in their code of conduct that nurses are responsible to maintain their health, and that they need to seek help if their health affects their ability to practice safely. And their saying is that if one has an empty tank, you're going nowhere, so it's time to refuel. And this is just evidence that we've seen tonight that demonstrates that, but it's also part of our professional accountability to have self-awareness and reflect on how we can do this. And so building those resources is really something that within our department has been key throughout the last part of this pandemic, for sure. Next slide. So when we looked at the program design for what we've developed thus far, we wanted to take a nursing approach to it. We wanted to look at the individual by first assessing their resilience, seeing where the gaps are. And most of us know where gaps are with our own well-being and our own resilience, but really taking an assessment approach just to identifying and having evidence around exactly where the greater gaps are within your own personal well-being and resilience. So identifying the gaps and then developing a plan, and then from there putting into action or implementing your actual resilience plan, and of course evaluating your plan. So it never happens until you are live doing a webinar that somebody comes to the door. My apologies. So the evaluation piece is really key here. And we know this as nurses when we're working with our patients, that we wouldn't continue doing something unless we evaluate it to see if it was working. And so therefore we should be doing the very same thing for ourselves to make sure that we are on track and on course to building our resilience and pouring back into our own well-being and our mental well-being to go along with it, physical and mental at the same time. So next slide, Jen. So in the modules that we have developed, we drew from what we already had. We had a really great abundance of resources within our self-care toolkit, and we drew from that to add those resources into our resilience supports. So with physical, mental, and emotional being key elements of resources that could be utilized. And within each area and each domain, there were apps that we've added. There were readings and resources, videos, and some of which I'll show you in the next few slides. But we really wanted to have an abundance of resources all underneath one umbrella so that one doesn't have to go searching everywhere for building their plan. So you'll find that within these modules, without a doubt. So that again, and one of the other things is really helping with those plans is some really pen to paper, hard copy tools that you can find, PDF downloadables on coping strategy documents that you can, again, set the plan out so that you can be consistent with yourself and when you're looking at building your own resilience. The links are all embedded within the modules, so you can either download them or even print them off. One of the things that I mentioned was some of the videos. There's some videos that are embedded. Self-compassion is part of the resilience resources that we've identified. And there's a wonderful YouTube video in one of the modules on meditation. And again, this is a fantastic saying, you'll never speak to anyone more than you speak to yourself in your head. So be kind to yourself. One of the things I really appreciate about what we've built as well is we really identify one's readiness and have the individual reflect on your readiness to improve your resilience. It's only going to be successful if you are in a place where you're ready to start making some change and you're ready to take the first step forward. And I was asked recently for individual resilience, where would one start? And sometimes it's just one step forward. It doesn't have to be a really large plan. It really is about the one step, but more importantly, it's about the readiness as well before you take that step so that, again, you're going to keep moving forward. We wouldn't want an individual to put a large plan together if they weren't in a place where they were ready and have the supports that they need in place to be successful. And so again, it all depends, right? Each individual resilience plan is going to look very different for one person versus the next. You know, it's going to depend on what's reasonable for that individual to commit to change. And it's going to depend on questions that they'll be asking themselves. How high are their current stressors? How have they been individually impacted? What are the resources that they have available to them? And what time and energy do they have to commit to change? And what are the simple goals that they could set that would make some sort of positive change? What is that one thing that they could commit to? So, you know, it's reasonable that change is going to be hard, but I think if you're committing to one change, whether it's, you know, a 10-minute walk every day, or it's just doing meal prep ahead of time for the week so that you are in a place where you have good nutritional health through that work week. It's making those subtle changes and committing to them and being consistent with them. And so it's going to depend for each person what that resilience plan is going to look like. And that's why assessing individually, so see where your gaps are up front, is going to be important, because one plan is not going to look like the next plan, the next person's plan. It's all going to be very individualized. Through that, what we've identified in our previous toolkits is that WeResearch has had quite a bit of success with individuals accessing our toolkit, and the numbers have been quite high. It's estimated that our toolkits have reached anywhere from 5,000 to 10,000 students, nurses, and other healthcare providers. I will say that there was an increase to our self-care resources throughout COVID, with, I believe, the increase being well over 30% with our analytics. Quarterly annually our analytics will be monitored to identify the usage of the program so we can see if it's hitting the mark that we hope to hit. And then the program will be reviewed and updates will be regularly added by our WeRPN professional practice team to continue enhancing it so that we are, again, building as many resources as we can to help individuals as they're seeking the support to build individualized resilience. And today, do one little thing to take better care of yourself and then repeat it tomorrow. And that's really the start of an individual resilience plan and where we hope nurses are starting to move towards. It doesn't have to be large and it doesn't have to be onerous. It just really has to be very much one little thing to take better care of yourself. So the first step towards getting somewhere is deciding you're not going to stay where you are. And that's sort of the message within our resources that we provide to our members and non-members seeking the support to build that individual resilience for themselves and ultimately giving them the sustainability as nurses that they need to care for others. So you'll find our resilience tools on our website now. They're up and available. There are 5 modules to the resources currently around designing your own resilience plan. And as I said, they're fairly in depth with a number of resources that are both audio, visual, and PDF downloadable as well. That is what we've got designed for individual resilience thus far at WeRPN, and we'll continue to build and work towards perfecting it and supporting our nurses to create better well-being and sustainability as nurses.
Thank you, Norma. And for any of those of you that are developing a plan and need additional support, both Norma and Sharon are resilience practitioners, and you're also able to reach out to them for additional supports. So with that, I'm going to move to Jen Calver.
Thank you, Annette. Dr. Connelly and Norma have given me a bit of a tough act to follow here. You see, and everybody can see the slides still okay? Wonderful. So I'm going to pick up around the topic of organizational resilience and just speak about some of the research outputs that came from the study that Dr. Connelly spoke about earlier. To get us started, I'm going to take a few minutes to speak about organizational resilience and how it was defined for the purpose of this research. Norma shared with us information around personal and leadership resilience. So here we're going to move forward to discuss how resilience extends beyond the capacity of individuals to include the workplace ability to foresee and act upon changes or disruptions that can be anticipated. It's also important to note that resilience can also speak to the ability to respond and recover from those events that we may not be able to anticipate. So the definition of organizational resilience that was endorsed by this research team was originally published by Wig and colleagues as a capacity to adapt to challenges and changes at different system levels to maintain high quality of care. And as Dr. Connelly shared in her presentation, the purpose of this research was to explore how RPNs were managing stress, conditions of work, and building those networks identified by components of personal, professional, and organizational resilience. So RPNs and the long-term care workforce, they face many challenges and adversities in their day-to-day work. And this has been drastically exacerbated throughout the COVID-19 pandemic, from anything from increased resident care needs to the chronic staffing crisis. There's been long-standing issues that are too much to place on the shoulders of individuals and teams. So to help guide the research deliverables from this study, WeRPN and Western University invited stakeholders with expertise in long-term care to participate in a virtual stakeholder forum entitled Promoting Organizational Resilience in Long-Term Care, Building Forward. So here at this forum, RPNs and family care partners, long-term care administrators, managers, nurse educators, and policymakers all came together in a virtual platform to discuss topics and around workforce preparation, the role of organizational resilience, and long-term care system transformation through policy, regulations, legislation, and accreditation. The results of the forum and the gaps identified in our research have informed the development of WeReSearch's educational package to help build and support systems of organizational resilience in long-term care. Informed by the findings in the study and the results of the stakeholder forum, an educational package was developed to include in WeReSearch's educational resources offered to members and partners. WeReSearch's Organizational Resilience, a guide for long-term care homes to support recruitment and retention of RPNs, was developed to provide formal leaders such as long-term care administrators, managers, and supervisors with this easy-to-use reference guide that can encourage actionable change within their organization. WeReSearch's Organizational Resilience Guide translates evidence-based information and offers recommendations to help build and sustain systems of resilience within long-term care that is supportive of residents, care partners, and the long-term care workforce. To our knowledge, the research around organizational resilience is really just beginning to emerge in the literature. The graphic presented on the slide showcases potential risks associated with low levels of organizational resilience based on our current understanding of the topic. So what we see is that resilience can impact staffing strategies, organizational costs, resident services. We can look at maybe consider occupational health and safety, as well as that overarching workplace culture. Lower levels of organizational resilience may be considered when experienced and senior staff begin to leave or plan to leave their workplace or even their profession. It may lead to higher rates of staffing turnover or elicit a sense of fear or apprehension for new staff to join or remain working in long-term care. Low organizational resilience may also lead to higher incidence of preventable occupational injuries, such increased absenteeism and sick leave, driving up staff replacement costs. Risks of lower organizational resilience may also lead to potentially decreased quality of resident care services from inconsistencies in the delivery of care with the staffing turnover and the different changes. For example, here we might see higher use of antipsychotics and other medications to just treat responsive behaviors, as resources to implement these non-pharmaceutical approaches may not be readily available or well understood. And that was just an example. Health and safety for the workforce may be impacted by increased tension and conflict around care teams, to include harassment, bullying, and potential for violence. RPNs in the workforce may experience higher levels of compassion fatigue, display symptoms of moral distress, injury, and burnout. The workforce might feel a sense of hopelessness and a diminished ability to cope with job stress and higher workload demands, ultimately impacting the overall organizational culture, including feelings of resentment or negative feelings towards organization or people within the organization. There could be a resistance or hesitancy for long-term care staff to bring forward their concerns with the goal to problem solve or identify a solution-based approach. The holistic and comprehensive approach to building systems of organizational resilience from personal, professional, and institutional levels within long-term care homes can support improved staff retention, thereby the consistent and safe delivery of high quality of resident care services to promote those optimal outcomes for each resident living in long-term care. Organizational resilience may support and sustain a healthy long-term care workforce with the ability to practice and utilize resources appropriately and effectively, while maintaining those higher levels of job satisfaction and staff engagement, which would support residents to live a life with dignity and joy. So at this point of the presentation, we've reviewed the definition of organizational resilience, the potential impact if an organization has low levels of organizational resilience, and we looked at some potential benefits for the high organizational resilience. But how do we move forward to build systems of resilience in our long-term care homes? So here's what we understand from the RPNs that inform the study and the long-term care stakeholders. For long-term care homes to build organizational resilience within their home, it's important to consider 5 key concepts: teach connections, build wellness, create healthy home areas, appreciate quality improvement, solicit feedback, and actively listen to it. Each of these concepts have been supported by existing literature, which has previously explored areas of resilience in the workplace. WeResearch's organizational guide and educational package supports leaders to identify strengths and opportunities within their long-term care homes to build and sustain systems of organizational resilience. Tools, resources, and supports have been made available to help long-term care leaders along their journey to building organizational resilience in their workplace, ultimately looking at improving or sustaining the health and engagement of their workforce, resident satisfaction, and quality of care, and create that welcoming environment for residents, care partners, and other stakeholders. We recognize that organizational resilience is not a program or a project. Organizational resilience is a way of thinking, being, and working to promote a healthy and sustainable workforce ready to adapt to challenges and adversities that may arise in their work in a way that maintains a positive culture of care and supports a quality of living for each and every resident. RPNs and the long-term care team show up every day with their hearts and their unique skill set to care and support residents with increasing health complexities that do require that 24/7 around-the-clock nursing care and support. A holistic approach that includes the integration of personal, professional, and organizational resilience can help foster a sustainable nursing workforce and support the home-like model of care envisioned for long-term care. Our research team will continue to investigate the topics of resilience and continue to share our findings to build the capacity to care and support recruitment and retention of the RPN workforce. Thank you for listening.
Well, thank you so much, Jen. I think it really ties the whole project together, looking at the individual, how we support each other in our teams, as well as we need the organizational support to be successful and resilient. So it's wonderful to have these resources. If anyone has any questions, please put them into the system now. We're happy to take your questions, and while we're waiting for those, I'm going to ask Dr. Nancy Snobelin, to talk about what's new at WeResearch and the research strategy, what new opportunities are available.
Thanks, Annette. Thank you to the speakers for presenting such compelling information. And I heard Norma say something about you can't do much on an empty tank. So I'm not sure she meant to have that analogy at this time when gas prices are so high, but we can tell that RPNs coming through COVID have really done so on empty tanks and are constantly trying to refuel themselves. But thank you to the speakers and to help us understand those protective factors and mitigating and trying to mitigate the barriers for RPNs during this crisis. I wanted to just talk about some of the things that the presentations this evening have brought up as excellent examples as to why research is so important to practicing RPN. So thank you to the attendees for participating in this third research knowledge exchange event. And we'll hope you will join us again in September, where we'll be inviting the 2 RPN fellows who were recipients of a 2021-22 RPN Research Fellowship Grant, where they'll present their experiences and key learnings. And it may be their first time presenting to an audience. So if you can join us, support their endeavors, and be inspired by your colleagues, we'd appreciate it. So this fellowship presentation brings me to the second key message I wanted to say, where we announced our second call for RPN Research Fellowship proposals in April 2020. And the application portal is now open to receive applications until May 31st, 2022. So you can see on the web and on the screen on the website, you'll look under research and research call for proposals, and then click on the call for RPN Research Fellowship proposals, and that opens the application. So if you have a research question or a quality improvement opportunity that you could easily turn into a idea, or can turn into a research question, and you'd like to learn firsthand how to study an idea or a concern, consider approaching your employer and looking for an academic mentor to assist you with the frontline investigation. The fellowships are valued at $12,500 for a wage and benefit replacement, and includes a 30% in-kind contribution from your employer for things like supervisor time, office space, computer and telephone use, that sort of thing. Everyone benefits from a fellowship opportunity. The RPN learns vital skills. The employer gets much more in return in terms of a credibly trained frontline staff can use evidence more easily. The academic mentor benefits from knowing more about RPNs. The patients, clients, and residents all benefit. The care partners benefit from a more knowledgeable and expert staff. And certainly we RPN benefits by creating that more robust evidence. So there's more information on the RPN website. And the other thing I wanted to talk about was I'd like to draw your attention to the nominations for 2 inaugural awards of excellence for research, one for individual and one for organization. These are individuals or organizations that support RPN research in a meaningful and purposeful way. And this is a great way to recognize your colleague or your employer who conducts or participates in RPN research and contributes to the literature in that more robust way. You can find the nomination portal on the WeRPN website under the awards tab. You can see it here. And you can nominate someone who you are proud of their accomplishments around research by July 29th. So if you need further information on either the RPN Research Fellowship or the awards for awards of excellence in research for an individual or an organization, you can contact me at nsnoblin@werpn.com. Now I'll pass it back to Annette to address any questions you might have and to close out our session for this evening.
Okay, well, thank you very much, Nancy. I don't see any questions in our Q&A section this evening. I might like to close, before we close this, ask one question of Dr. Connelly about her study. What was the most surprising finding?
Surprising to the researchers, I suppose, was I think it was my first exposure to RPNs, I must admit, and I am so impressed by the duty to care and how they just plowed through, as they say, in their own words, and just kept going despite everything. It was really, I don't know if it was surprising as much as remarkable. And I really enjoyed that part, and knowing that they're out there and doing all that really great work through thick and thin. So I'm a big fan.
Well, thank you. We're a big fan of your research and supporting the value of RPNs in our healthcare system. And we're looking forward to your next body of work as well.
Yeah, thanks. It should be really interesting to see what the difference is in resilience experiences of RPNs working in home and community. We have a great team, and it's quite broad with stakeholders who are involved. So I'm really looking forward to seeing what that produces.
Yes, so are we. Well, with that, I think we'll wrap it up for the evening. I'd like to thank all of our presenters once again for your time and dedication to research focused on the RPN role and the value it has to the healthcare system. Thank you all the participants for taking the time this evening to attend as well. And with that, we wish you a good evening. Thank you. Goodbye.
Thanks, Annette. Good night. Thanks.
Thanks, everybody. Do we
Thank you.
know how many people it